People are intimidated by pharm. How many people in here just downright dislike pharm? A good majority of people come to me and they say, Dr. Z, we don't know pharmacology. We don't know pharmacology. Those of you that are in the course, those of you that have been in the course, when I teach pharm, I don't just teach pharm just so you know the drug. We work up to it. We learn the pathology. We learn how it's going to be asked. We learn what medications are used for certain things. But ultimately, on the boards, there's only 5 ways that they're going to ask questions regarding pharm. That's it. So when you see a pharmacological question, you need to understand they're only going to ask 5 different ways of pharm questions. So the first one is identifying it. Identifying the medication, knowing what medications are which ones. I like doing system by system. Anybody that's been in the course or done the on-demand, I do cardio pharm. I do respiratory pharm. I do GI pharm. And we add it all in as a progression. Identifying the drug and knowing what they're used for is super important. But also knowing their side effects. Very important to know side effects as well too. Because if this drug is commonly prescribed or it has a very bad side effect, then we need to know it because the boards love those, right? The other thing is what they're contraindicated with, which means if a drug is being used for a certain medical condition, there may be certain other drugs or certain products that you cannot consume simultaneously. Okay, so it could be drugs, other drugs, it could be supplements, it could be over-the-counter stuff as well too. So we want to make sure that we know our contraindications, and the type of question those will be your further teaching, further intervention, or straight up freebie. Dosages. Now, the thing about dosages is that there are very few drugs that require dosages on the boards, okay? A lot of other drugs, like let's take an example. EKG lecture. We talk about adenosine, correct? We talk about administering adenosine. Do we have a specific way of administering it? Yes. Do you have a specific dose, specific location? Yeah, absolutely. That's one you need to know. But let's look at this little quick tip here and say, hey, look, statins. Well, what if I started them on like simvastatin and it's like 20 milligram or 40 milligram or 6 milligram or 80 milligram? Which one do I use, Dr. Z? Which one do I use? Well, that depends. That's a great real life question. It's not a board question, right? But with dosages, what they're going to do is they're going to say, well, this person was started on a statin. I'll give you an example just using statin. They were starting a statin. Their cholesterol went from 290 to 250. Is the statin working? It sure is. It's working. But what are we going to do here? I don't know the dose. They didn't give me the dose. But what they can ask is, what will we do? Either you will increase the dose or the frequency. So you make a dose adjustment. So that's another way they would ask it without giving you an actual dose. The last one is education. How are we going to administer it? Let's talk about insulin real quick. Do we give the injection at the same site every single time you take it? No, right? So proper use of medications, the do's and don'ts. Do I eat cheese with MAOIs? Wine or cheese or processed foods? No. Hypertensive crisis, right? So we talk about all these section by section. I just did endocrine with you a little bit, and I just went to mental health. So you need to know these things, right? And again, those points of clarification and understanding. Good job. Way to recall that tyramine is what we're concerned about. So these are the ways the boards will ask farm questions.